Welcome to Leading at a Higher Level. This is Mark Forsyth, and today we have two very special guests. Nantucket's Maureen Hackett, supporting many important issues on the island, and recently established the Hackett Center for Mental Health. This week on Nantucket, Maureen and Jim Hackett are hosting Nantucket's Children's Mental Health Summit, bringing together some of the nation's top leaders in children's mental health. The goal is to encourage collaboration, share ideas, and lead to better mental health policy everywhere. At the summit are leaders from the Massachusetts Association for Mental Health and the Meadows Mental Health Policy Institute. Andy Keller, who is the CEO of Meadows, is also in the studio with us today. Welcome, Andy. Meadows has helped the great state of Texas identify systemic mental health needs and solutions to become a source for better mental health policy. I have to set some context for this show. On this show, we share how to lead organizations at a higher level, how to embrace the quadruple bottom line, how do organizations become the provider of choice, the employer of choice, the investor of choice, and the steward of choice. When companies perform at that level, their people thrive, material well-being improves, and overall life gets better. But is it? I read an excellent column by Cynthia Coons in Bloomberg's June 24th edition, Business Week, and she outlines a very compelling thesis. Here's some of the facts. In 2017, there's 47,000 people died from suicide, and 1.4 million people attempted suicide. Drug overdoses kill over 70,000 people a year. 17 million adults, that's about 7% of the adult population in the US, have had a major depressive episode. Life expectancy in the US has actually fallen the last 3 straight years. So we are in the midst of a national mental health epidemic, and the damage is on the scale of the Great Recession. Mental illness and substance abuse cost US businesses between $80 and $100 billion per year, according to the Center for Workplace Mental Health Study. So here in the studio, we have two guests that plan to do something about it. So
Good.
Welcome.
Good, thank you, thank you.
So we always lead off our show about what's your Nantucket story. Mm-hmm. And Maureen, you've been such a big part, you and Jim, of the community and been supporting so many important causes. So we'd like to know, what's your Nantucket story?
Interesting. So Jim and I started coming here back in the late 70s, students in the Boston area, and fell in love with the island. Came back, I want to say 18 years later with children, and they loved it as well. And we rented for 15 years, and then we purchased a home. And so we have been coming and going, I would say maybe 20 years, 25 years as renters and homeowners. Our story is this is home. Mm-hmm. This is our home, be that in the summer, the fall, Christmas time, this is our home. And our story is if you have a home and you're lucky enough to be so, blessed enough to be so, you become a part of the fabric of the community. And when you've been blessed, as we have with hard work and payback, it's our duty to pay back. So that's, for us, getting involved on the island with not-for-profits has been important and has been able to help us model for our children and now our grandchildren that this is important to do.
That's great.
Thank you.
Well, Andy, this is your second year on Nantucket in support of the summit. Yeah. So with the summit, what did you achieve last year and what do you hope to achieve this year?
Yeah. Well, the whole idea of the summit was to recognize the fact that mental illnesses are really pediatric illnesses. They start in childhood. By the time you're 14, 50% of all mental illnesses have manifest themselves. So these are really, illnesses that begin when you're a kid. By the time your brain's done developing in your early 20s, 75% of mental illnesses have manifest. So we really need to rethink how we approach this and really start looking at promoting healthy development, helping families and children recognize, things like mood disorders like depression, anxiety earlier. So we said, how do we do that? Let's bring together, leaders, and actually in your two homes, in your home here in Massachusetts, but also your home in Texas, mm-hmm. and bring those leaders together, because that was really what the Hackett Center for Mental Health, when Maureen and Jim established that at our institute last year, that was its purpose, was to take the best policy, the best programs to figure out how to bring them to life, how to bring them to scale for everybody. So we brought together the leaders of our medical schools in the Houston area that work in the area of children, Texas Children's Hospital, brought those folks up here to Nan Tucket. They were happy to get out of Texas to come up here. Convinced their colleagues on the mainland to come on out from basically the Massachusetts medical schools, Boston Children's, and to have a discussion about if we were going to do that, if we were going to take it seriously that these are pediatric illnesses, what would we do? How would we make sure that every child had access to mental health checks at their well child checks? How would we make sure that parents had access to the best advice to be good parents to a child who, like me, has a lot of anxiety? That was my thing. So that's what we did. And so we got together last year, shared ideas. Basically, everybody shared, here's the things we think have had the most impact. And we were fortunate enough to have a lot of those things put into practice really through our last legislative session in Texas. We had some really hard things happen in 2018 in Texas. We had a hurricane the fall before that the implications of extended throughout. We had a very tragic school shooting May of 2018. So there was a real commitment in our legislature to, we need to change this. And so the ideas that we brought out of the summit really were at the core of a lot of changes that got put into place in our legislative session that ended this last, just back in June. So that we implemented stuff. It was super exciting.
Yeah, making traction.
Yeah.
Right.
So for both of you, so especially for the Hackett Center for Mental Health, key pillar to leading at a higher level is setting the right vision. So how did you and your family and Jim kind of set that vision, and then make sure it aligns with what Andy's trying to do?
Right. So take it back to the Policy Institute. I was invited to join that board and had a good number of months, 18 months to 2 years, to listen to what it was that they wanted to do. Jim and I have been advocates for mental health for 35, 40 years. Anti-stigma, better care, better workplace mental health insurance, et cetera. And in my lifetime, I like to be a change maker, and I was not seeing the needle move at all. So what attracted me to us as a family to make this lifetime gift was the fact that this Policy Institute was going to help us move that needle quicker than I would ever be able to do on my own, because we were going to make it law. Putting policy into practice is our tagline. So years of advocacy, personal instances, crises with mental health, our own children, my siblings, parents, et cetera. So, we looked at each other and said, we've got to do this. We can, and so we've got to do this. So we've got to change this. We can't just continue to talk about it. Got to execute.
And there seems to still be a lot of talk, but can you share some examples, like some satisfying...
Some wins.
Some wins.
Yeah.
Right? You've got some wins at the legislature, but how is that trickling down to people? Like, what are some real satisfying moments for you?
Well, I think Andy can speak to this better than I can, and I will tell you that in addition to why we established this Hackett Center, to Andy's point, Hurricane Harvey affected so many people. When I saw the number of kids, over 1.5 million, just in Harris County, which is the largest county in the state of Texas, affected, I knew it was the time. We had to make a difference. So Andy can speak to the wins, legislative wins, not just in children's behavioral health, but other areas.
Yeah, well, that really, I think, was the catalyst, right? Seeing what was happening, but also seeing the possibility that we could do things better. When Hurricane Katrina hit, in the mid-'90s, it was a terrible tragedy, but we really didn't talk about the mental health impacts then. It just wasn't really in people's kind of vision. When this hurricane happened, which was not as intense as Katrina, but it saw a huge geographic area, like from Corpus Christi to Beaumont, so over 200 school districts. Like most said, 1.4 million students. So people immediately thought, well, what about the mental health of these people? And also not just the students, but also their teachers who are teaching in a destroyed building, they're homeless. How does all that stress impact? So what we did as the Hackett Center was forming, the Texas Education Agency, which is our state agency that helps schools, was overwhelmed. How do we respond to this? We have 200 different superintendents and thousands of principals. How do we respond? So we basically said, we'll help. So we helped organize the response. We did a needs assessment, figured out which schools were more impacted, helped get, really then worked with philanthropy. We worked with several foundations, the Hurricane Harvey Relief Fund at the Greater Houston Community Foundation, the Rebuild Texas Fund, and basically help matchmake between philanthropy and schools in need. So through the efforts that we were able to do, we were able to get over $22 million of aid around mental health to basically put in place temporary counselors, to do telehealth connections. So there's a lot of psychiatrists in Houston, but not a lot in down north of Corpus Christi, which is a very rural area, which is most impacted. So we basically beamed those therapists in, set up the equipment, got all that in, and so we did matchmaking. The schools did the work, the foundations funded it, but we did the planning and the sort of the logistics around that. The neat thing was we got a lot of people got help. Over 200,000 people were helped through that process. Probably much higher than that, but we know at least 200,000. Yep. And we were able to show people, and I think this is the important thing, these aren't just needs, these are needs you can do something about. Like you can help somebody get over their depression. You can help somebody be anxious, but maybe not develop post-traumatic stress disorder. So the legislature then, when we had that horrible school shooting, said, what can we do? We said, well, it's the same thing we're doing for the victims of Hurricane Harvey. It's the same thing we should have been doing really for all sorts of situations before. So they took those examples and scaled them up, and they passed this law, Senate Bill 11, which basically created $200 million of ongoing funding for mental health supports to children and in schools. And so they kind of took that stuff we piloted it with philanthropy and then took it to scale for the whole state. So it was kind of, that's really, to me, the perfect story, right? Where you try something, you learn, and then you take the things that worked and do them more.
So he will tell you the win is, yes, we got the funding, and I will tell you the win is, another win is they sought out the Policy Institute people for the statistics, the analysis. We didn't call them up and say, can we testify? No, they wanted the experts, so that's a huge win.
Yeah.
That's a huge win.
Using that data to make good policy decisions.
Yeah.
And
that's leadership.
Impact.
Yep.
And it sounds like you did it fairly quickly.
Yes.
Which in these days.
Remarkable.
That's a nice thing about having, an institute dedicated to this. I've got 60 people. So when somebody says, well, how are we going to figure out how many people are going to be impacted by the storm? We said, well, we know how many were impacted by Katrina. So let's extrapolate. Let's look at that. And we were able to give them a pretty good estimate.
Yeah.
And, it wasn't a perfect estimate, but it was enough to kind of know how much service we needed to increase. So those being able to point to the answers, which again, this summit was instrumental in.
Very much so.
Because by bringing the best people together and saying, well, what should we do? We kind of knew. We had a list of things to do, and we, fit with some of the stuff we were already doing. But you got to be ready to give people solutions and not just point to the things that are going wrong.
The true problem-solving session.
Yes.
Sounds like. Yeah. That's great. Well, we're going to take a real quick break here. This is Leading at a Higher Level. Today we're joined by Andy Keller, CEO of the Meadows Mental Health Policy Institute, and Maureen Hackett with the Hackett Center for Mental Health. So we'll be right back.
Leading at a Higher Level Nantucket is brought to you by the Ken Blanchard Companies and FT Press, an imprint of the world's learning company, Pearson, whose mission is helping people make progress in their lives through learning. The new third edition of Ken Blanchard's Leading at a Higher Level is available at informate.com/Nantucket.
This is Leading at a Higher Level at Nantucket, and today I'm joined by Maureen Hackett and Andy Keller. Welcome back to the show. So, with the work you're doing is setting policy, setting law, and really having an impact, clearly, and having an impact quickly, which is great. But another side of that is how do you get the word out, and how do you get people to actually admit that they need help? So you've got two interesting things happening here on island, but also back in Texas, which will hopefully spread from there. One is your Anti-Stigma Campaign, Okay to Say. So I'd love to hear about that. And then also you've got a documentary filming Friday night at the Boys and Girls Club, I believe at 6 o'clock, which is called Angst. So I'd love to hear about that and how those two elements fit into your plans.
Great.
Well, so one of the biggest things that's actually for any medical condition is recognizing that you need help and then taking the steps to get help. And I think we've seen with surveys, and I think people just kind of know this in their own family and lives, that it's harder to talk about mental health needs. But it's getting easier. People are getting more hopeful. People are sharing their stories more, and that's encouraging people. And that's the idea behind Okay to Say. So Okay to Say is a campaign we've been running now for, I think, just over 3 years that really focuses on using social media and people sharing their own stories through video, through posting notes, or just saying, I support that it's okay to say. And so showing that they're willing to share their story, they want to encourage other people to share their stories. we know that 75% of folks either themselves or have a loved one that's affected by mental illness based on our survey, which was the exact same percentage as cancer. And so, like, if you get cancer, you know, people at your church are going to know. They're going to make you a casserole. They're going to, you know, they're going to know when you're in the hospital. If you have a loved one who's in the hospital for a suicide attempt or for depression, you're probably not going to tell anybody. So we're trying to get it to where, you know, you get casseroles and you get support. And so that's the idea behind OK to Say. And,
Right.
And I think a lot of it's getting the message out that this is something that you're not alone, and also you can get help, which to me is what's so cool about the Angst documentary, which you just saw yesterday, right?
Right. Real stories, real people. And I think that in itself is a great start. Much like OK to Say, if you have people that, let's say the Hacketts, we share a story. Most people will think we're Ozzie and Harriet and life is perfect, and it always has been. And you have to bring it down to a human level and talk about the fact that we went through this, we got through it, we got help, and suggest that other people get help. I think, back to angst in a second, I think one of the things about OK to Say, the next generation, my kids who are in their 30s, 40s, they have a much easier way of talking about this. They'll go to dinner with friends and somebody's got a problem at work, or they've got a problem with a boyfriend, or they're not sleeping, and they'll offer up, it sounds like you need a little therapy. Let me recommend somebody. So I think that's important. I think this film Angst, bringing in these kids from 10 to about 16 years old and talking about how they feel, the parents in the audience, the teachers, the professionals just think how brave, how courageous of this kid. Well, with Angst, we want to get that across the country and have people start talking about it. And more importantly, with the Policy Institute and the Hackett Center, start to provide what it is that they need, solutions. Let's no longer talk about it. The need has been pounded. We know the need.
Right.
We need to work on what's the solution. And I think Angst is a way to do that, and I think OK to Say is a way to do that.
Yeah.
There are many campaigns out there doing this.
Right.
There's many apps. There's a lot of social media doing this, and that's one of the best things about social media is spreading the word on mental health.
Right. Well, there is the spray and pray way.
Right. There is.
But it sounds like what you're doing is more targeted, and that's interesting about the generational aspect of that.
Oh, sure.
And how the younger. Seems like the younger generation is more open to talk, so that does give us all hope.
Yes, and learn. And the parents of today, the young parents of today, want to understand, how do I take care of this child with tremendous anxiety? Right. What do I need to do? What are the tools that I need? My own grandchildren, and my own daughter, young mother. So I think social media is great.
And I think too, encouraging people to tell their story, or whatever it is. I think a lot of times when we talk about mental illness, we're talking about point of crisis. So we're talking about a suicide attempt. We're talking about someone that was arrested, and really, like any illness, it began much sooner. We used to not do anything about heart attacks until people had a heart attack. Now we know that that process starts decades before. So Angst, which is about anxiety, is encouraging people to share stories of their own anxiety and to talk about that. And a lot of times people think, well, it's just anxiety. I'm just, I feel uncomfortable in these situations. That's nothing special. Well, unchecked, unhelped, that can develop into something. It doesn't always, but the sooner you get help, the sooner you identify. One of the issues is right now, when the symptoms begin, we wait on average 8 to 9 years before we do anything. So that's when the anxiety that maybe causes you not to go outside at recess or not to have as many friends, you go down that path, you're 15, you don't have as many friends, and now something, your parents get divorced, something happens that's part of life, but you don't have the supports to deal with it, and it's super devastating to you. Well, that process, really had its roots a lot earlier with just not having the supports in place or the skills to know how to deal with something like that. And so that's part of the idea, is to help people get help sooner and to do something when it's easier to deal with.
Right.
So how does one, as a young parent, or how do you access OK to Say? Like, what's the format? Because you've got me excited and engaged. I want to make sure our listeners are as well.
Yeah.
Well, so you actually go on oktosay.org, OK2TOSay.org, and then the website, you can get information, you can see other people's stories, you can share, or you could just click to say you're a supporter, or you could just, what's it called? You can just check it out. You don't have to do anything other than just be inspired by what other people
just observe.
Yep.
It's great though.
And the other thing I would encourage parents to do if they have questions about their children is bring it up when you go to your well child check with your pediatrician. Say, hey, I've got a concern about this, because that's what your doctor's there to help you with. And pediatricians actually know a ton about this, and if they don't, they need to learn, which is a good cue to them. And then one neat thing that Massachusetts has is the Massachusetts Child Psychiatry Access Program, which is a mouthful. But what it basically means is any pediatrician in the state can call this number during the day if they have a question about a mental health question for one of their patients and get an immediate consult from a psychiatrist. And this is the program we learned about last year that we're implementing in Texas now.
Another win.
So it's a way to get the information, go to your doctor, you identify the need, your doctor can get you help immediately.
Yeah.
You don't have to come back for another appointment. They can tell you what to do.
It's a dream of mine to have, which is why we did the Children's Behavioral Health, but it's always been a dream of mine. When I went to kindergarten 1,000 years ago, you put the eyes on and you figured out where the airplane was, the glasses, figured out where they, and then you listened in your ears. No one asked me, what do you do for fun? How's dinner? What's that bruise on your leg from? You lost your grandma?
Yeah.
We need to do that and get there quicker. So the numbers that you quoted, in a perfect world, there's going to go all the way down.
Right.
Yeah.
We've done it for cancer and heart disease.
Right.
We have.
Those are the first two leading causes of death. Suicide's the third leading cause of death.
Yeah.
And so we just need to now move down the list and do it for suicide.
And younger and younger.
Yeah. Well, as leaders, tackling this really important issue, how do you feel that you were called to this, or do you feel like you were driven to solve it?
I would tell you, I feel as though I was called to do this. Grew up in a very large family. Dad was an alcoholic. Tons of anxiety as a child. Prevention. Speak about it. Yes, I do feel philanthropy for me has always been a calling.
Yeah.
I mean, the true definition, which is taking care of humankind.
Right.
Everybody.
Right.
So it is a calling.
And Andy, you're on the front line. You're CEO, very important policy institute.
Yeah, well, it was real similar in the sense of really want to make a difference. That's why I became a psychologist. I thought I was just going to help, individual people.
Yeah.
But this policy piece is a way, I think, to help make the environment better so that other psychologists, psychiatrists, social workers can make a difference. And I think, too, it's something that, we've helped each other. I feel like, Mo and the other people on our board, have helped raise my standards. So I came in, I've been a consultant for a lot of years in this space working on these issues, but it never occurred to me that we should try to help everybody with depression. It seems silly to say, but it's an awareness. We should just say, well, we'll do our best.
Right.
Well, no, we need to actually help everybody. We need to set that goal. And there's more people that have diabetes every year than depression. We somehow feel like we can try to help them. So so I think that calling has been reinforced by the callings of the people that have come together at the Hackett Center and at our institute. We've kind of helped elevate each other's calling by kind of challenging each other, really.
And people come to us, not surprisingly. I have a child with, my husband suffers with, my assistant, the coach. What do I do? So just that's great. Just asking. It's working. Yeah, they're listening, reaching out.
So again, it's such an important topic, and you were definitely called to solve it, which I love. It's such a key element of servant leadership. What influenced you? Were there some influencers in your life that made you want to tackle this?
Surprisingly, as much as I hated grammar school, I went to a Catholic school. My faith has driven me to this, for sure. I have a great life partner, husband, who is a servant leader. He's been an enormous support, but he's also been an influencer. My mother was a rock star. She was, the mother of 11 of us. Dad was an alcoholic. She was the breadwinner. She was also the mom. She was also the coach. Changed the diapers, and that was a leader who knew she had a job to do, and she just would get it done. But her faith drove her. So a great model.
That's great.
Yeah.
What a great role model.
Yeah.
Well, thank you both for coming in. It's such a wonderful story, and I love what you're doing with the summit, and I love that you're here on island and you're pulling some great thought leaders together to solve some of these issues.
Hope so.
Good on you.
Thank you. Thank
This is Leading at a Higher Level, Nan Tucket, and we'll see you next week.